elephant in the room in which government handlers are beginning to say, really, we have a problem. And it's not just about the medical doctors. Nurses as well are moving out. Almost everyone in the personnel in that ecosystem are moving out. And we have with us two gentlemen. One flying, is trained here in Nigeria, Dr. Adedapo Adetoye, and the other in the UK, Dr. Ayodeji Akonde. Thank you, gentlemen, for staying with us. Let me start with you, Dr. Akonde. Now, what's the catch, really? You've hinged on the issue of, facility and all of those things, but truly, what's the catch there? Is the grass always green? Is it as easy as people deem it to be? Because we've seen people japa and we have seen people japada as well. Is it always as easy as it's painted? You have everything needed, the pay is so great, and then you are living the life of your head, in my Yoruba parlance. Is it always as easy as? Is the grass always green?
Yeah, thank you very much, Emmy. You're quite correct. It's not, the grass is not always as green as you thought it might be, and not necessarily about the pay. Even the fact that you are leaving your home country, your home, to another place, and to start a new life all over again, getting used to the tradition, the culture, and all those things, it's very difficult, I must confess. Very difficult, very, very distressing to the mind, So on that side, I would say it's not really easy. However, on the part of remuneration, on the part of enjoying what you are doing, job satisfaction, if you have your plan very well, if everything is well spelled out, there shouldn't be much problem, really. And let me quickly add this to this, because we have emphasized, and we can't overemphasize it, really, the role of government, what the government needs to do to ensure there's a reversal of this ugly trend, is the fact that even our society back home in Nigeria, they are not helping matters as well. And the reason why I said this is that, during your last program on Saturday, I made a comment on WhatsApp when I sent my message that the way the society also treats doctors and even other health workers, it's not really encouraging, I must say. All right, there in Nigeria, as a doctor, if you want to buy anything, once the seller spots you and this is a doctor, the price will change. Cut me anywhere. I told you I've practiced in Nigeria for more than 13 years, and I know what obtains. I've lived all my life in Nigeria. I just started working here 3 years ago. But over here, the fact that you are a doctor, almost everything you are buying is discounted for you. Almost everything, you are so valued. The society values you a lot. But back home in Nigeria, you are the ones that one seller, one business person wants to swindle, thinking that he has the money. You are the one that you will suffer some physical assault abuse outside there just because you are trying to help someone. Let me give you another example. Another one, very tough one. During EndSARS protest, I had an emergency in the hospital. I was working in Ashibero, and I went there. On my way back, I just ran into the protester, and they saw doctor's tag on my car. I was almost lynched on that day. But fortunately for me, it was around Onward area. Fortunately for me, two guys spotted me, and they could have been, Dr. Majek, no, let him pass me. And that was how I was able to escape that lynch. If those two guys were not there, I'm very sure I would be beaten and my car would be vandalized. In fact, immediately I drove out of them, I just parked somewhere and I was shivering. You could imagine that just because they saw the tag of a doctor on my car. So the society too can do better beyond whatever the governments are not doing, beyond whatever we expect the government to do. Let the society also have better attitude towards our doctors, towards our nurses, towards all health workers. Please, they are doing their best to ensure that people live in sound health, in well-being, and they should not be suffering assaults on your hand in the process of doing that.
All right, Dr. Akonde. Like you have rightly said, I cannot really blame you and other Nigerian doctors who have decided to move to other countries, but it's quite painful. It's really painful. Some years ago, a friend of mine, I was actually rooting for this guy, a brilliant guy, who was a senior registrar in the Department of Oncology at the University College Hospital Ibadan. Promising guy. So he was actually on the verge of becoming a consultant oncologist. He was just 30 at that time. So unfortunately, this guy changed his mind and decided to move to the UK as well. So right now he's practicing in the UK. It's quite painful because Nigeria is losing talent. A lot of talented people are leaving. But my question to you is this, Dr. Akonde. You've said it all. I can't really blame Nigerians who leave Nigeria. But for you as an individual, what can be done? What would you see happen in the Nigerian healthcare sector today that will make you decide to come back? What would be the catch for you? What would you see that will make you say, oh, I am going back to my country. I'm going back to Nigeria to practice. What exactly can bring you back to Nigeria?
Okay, just before I answer that question, I know that during this my productive year, I know I will spend the entirety of my productive year in the UK. I will come back to Nigeria to give back to my country. I love my country so much. That's by the way. But what I want to see in Nigeria that can bring me back now at the moment, first, I want to see a more conducive environment. And what do I mean by this? I want a situation whereby I will enjoy what I'm doing I'm a psychiatrist. I will enjoy what I'm doing as a psychiatrist, and I will see my patient smile. I will see that these are the needs of my patients, and the needs are being met, come what may. Here in the UK, all psychiatric medications are free. You don't pay a dime to get your psychiatric medication. So the best of the best medication I can prescribe for my patient, and they will take it and they will be fine. And beyond that, you know, the nature of my specialty is that many of our patients, once they are knocked with this illness, many of them sometimes they cannot do anything on their own again. They live an independent life, and they will be supported by the government. Some are living in government houses, so supported living, and you keep on following them up, and they are doing very well. I'm not sure. I don't know, because when I was in Nigeria, there are many occasions that out of my pocket I will have to give patients money to go and buy their medications when they come from their clinics. So things are very, very tough. And the question you asked me is a very tough one. But whatever the case it is, I will definitely come back to Nigeria. But talking about solution, two things I have in my head: short-term and long-term solution to stop this trend. I don't know if I can go into
Please
that
go ahead.
now.
Please go ahead.
Go ahead.
Okay. So I have two solutions, short-term and long-term. The short-term is something that looks like we do it here also in the UK, where you have some temporary placements or local with extra pay. Okay, I'm working with Universal Teaching Hospital. This is my salary. Fine, yes. But I can also pick some shifts in other places. For example, I'm from Ilorin, and I'm very sure the general hospital in my hometown may not have a doctor. That's the truth. So someone working with Universal Teaching Hospital can just say, okay, let me pick a shift on Saturday and go and see pregnant woman for the antenatal and arrange an antenatal whatever for that weekend, and government will pay me. These are ways we can manage the little ones that are still back home in Nigeria. Beyond increasing their salary, let there be other incentives by redistributing these little resources that we have. That is very, very key and important. Number two is that, like I mentioned, society needs to do better. They need to change their attitude. Let there be more positive attitude towards doctors. Right. And the third one, on the long-term basis, of course, we really need to increase the capacity of our medical school to produce more doctors. It happens almost everywhere. In India, many doctors in the UK here are from India, and I'm not sure they are making a lot of noise about brain drain. We can increase the capacity of our medical school such that we have more doctors that are graduating from our university.
All right, we have a limited time. Of course, we can't exhaust this particular topic and the solutions today. Dr. Adetoye, you are on ground here. More than 2 decades of you practicing your profession, going through the ranks to where you are right now. And you see colleagues, you see students that you have trained moving out in droves, and possibly it's on WhatsApp status that you even get to know that some of them have jackpot. What do we do in a minute?
In addition to what Dr. Majek has just said, which is a good one, you understand the government can do that. It's practiced anywhere else. Is the fact that, see, the conversion rate, as in the value of whatever you give anybody in Nigeria, will make sense based on the economy. The economy should be improved. There should be improved security in the environment. Imagine if that day he's been lynched, who knows what would have happened to him? So even if he tells this story to his children, they will not want to come to Nigeria. Please don't tell them this story. See, those are the issues. So if security can be improved, if the economy improves and the value of Naira also improves, that means whatever you are earning now, you have more purchasing power. Then I feel these people that we are complaining about their immigration should be specially categorized. Let's stop talking about this generalization. No, if we do this, these people will also shout. No, even in the UK, there was a time they had problems with teachers, and they had to import teachers from other countries. They put them on special grade. They gave them special class so that things can work for them. They can entice them. They will even find out, what are you anywhere you are present? Let me now shock you. There's even brain drain within the nation now. People are resigning from federal medical centers, teaching hospitals, and going to private hospitals in Abuja and Lagos, who are attracting them with more pay. Somebody is earning peanuts as a professor in teaching hospital, and is now going to earn like 10 times that in the private hospital somewhere within Nigeria. Will he not go there with an accommodation? And they are buying him 100 million naira worth of housing units. It's his own. They will deduct it from his money over time. These are things that we've told the government. Give the people car loan, give them housing facility and the likes. While they are servicing all those, they will not leave as long as you keep them well remunerated and you are taking good care of them. But when you just make them look like ordinary, everybody wants to assert himself. He wants to feel good doing what he is doing. But if that environment is not making room for that, it becomes a problem. And because of how the younger ones are seen, like he just said now that we should expand the capacity of the medical schools. The Nigerian government is trying to do that, but I'm wondering who will teach them the way we are going now. People are retiring, you understand, and new people are not coming in. Let any university advertise now for lecturers in the clinical services. You see that nobody will apply because that will drop your pay.
All right, Dr. Akintoye, just before we go, Dr. Akintoye, you are in Nigeria, and so far you've been in Nigeria for a long time practicing here. I just want to ask you this direct question. What would you like to see? You said the other time that who knows, that you might just change your mind and decide to leave if something happens. But again, what would you see? What changes would you like to see in the Nigerian healthcare sector that will make you say, in fact, I'm going to stay here and put in my best to serve my country?
Okay. Let me put this straight. Having practiced my profession in Nigeria for those number of years, I can tell you I visited so many countries, practiced them. Went for training, practiced in some, and came back to Nigeria, even when I had the opportunity of changing my mind. So what we are still saying is the same thing. Please put these facilities in their proper position. He just said it now. He can prescribe any drug. But even some health insurance in Nigeria will limit what I can do. How do I get results? How do I go to take my car to a mechanic and tell him, see, we can't go beyond 5,000 naira. Am I ready to repair that car? You know, it doesn't work. So we should be truthful to ourselves. Right. Put the facilities in proper place. that I will be able to work in a conducive environment, make sure there's security, improve the economy of the nation.
All right.
And pay me well. Something close to what I will earn if I go out of here.
All right.
I don't have to travel.
Thank you very much, gentlemen. A very special intrigue is the one that you even said there is local JAPA, people leaving federal institutions to the big private hospitals. But we will keep talking about these issues until we'll see the desired change that we want in our nation. Either like Dr. Akonde in UK, or you here in Nigeria, or somebody watching us from Barbados. All we want is a working nation, especially in this health sector. Thank you very much, gentlemen. Former chairman of the Nigerian Medical Association, Ocean Wing, Dr. Adedapo Adetoye, and of course, medical practitioner, a doctor in the UK, Ayodeji Akonde. Thank you, gentlemen, for your patriotic take on the program today.
Thank you for having us.
Thank you.
All right,
thank you for having me.
Thank you. We'll go on this quick break. When we return, we speak to the issues. You know what they say about when an investor crashes and the investment crashes. Not the Sabino's investor right now, but some very hard situation that people have found themselves about a particular investment program. You get to hear more after this.